Good morning, good afternoon, everybody from, I hope, different parts of the world. Welcome to Tech for Eva Roadshow. This is a roadshow in collaboration with Swiss company SICPA, one of our supporters and also sponsors. So my name is Lan, the co-founder and director of Tech for Eva. For those of you who do not know yet, Tech for Eva, this is an equity-free startup accelerator. It's international accelerators created jointly by EPF Innovation Park and Go Mutuel, a Swiss insurance company. And EPF Innovation Park is the leading science park of Switzerland. We have the goal to advance technology for women's health and to support women, the FemTech company around the globe in the effort of bringing innovative solutions to the market. We also want to create an ecosystem around accelerators so that startups, corporates, and local healthcare providers can join forces and to integrate these FemTech solutions for a better prevention and better healthcare of women. Next slide. So next ones. Concretely, we offer knowledge workshops to help startup founders to develop their business knowledge and know-how. And we organize yearly twice the conferences to talk about various issues about FemTech and also to showcase our startups. We organize international roadshow in different states of the world to make exposure of startups to potential investor and also potential customers, including roadshow within the company and like today. And we also facilitate partnership between startups and corporates or other people in the value chain. We make introduction to investors and we offer mentorship to all the startup that we selected, and this mentorship is often offered by company executives. So we have in our network around 40 plus corporate mentors to help startups to grow. And by doing that, we try to build a community to further exchange. Next slides. So in our 4 years operation, we have helped in total 94 startups, FemTech startup. And we have also formed a large FemTech solution portfolio covering, as you can see, different stages of women's life cycles and related conditions, and all the needs for well-being and prevention. As you can see, there are quite a lot of solutions in the reproductive health, mental, maternity health, oncology, women's specific diseases, etc. These startups were selected from 570 applications worldwide, showing a strong interest in the platform like ours, and also the urgent need for support. Among the startups that we accelerated, some of them have become very successful in terms of fundraising and business development, or they get acquired, and others are still making constant progress, and very few are failed and closed down, lack of financing, or due to other business challenges. Next slides. Since the beginning of our initiative, we have been talking about importance of FemTech from different angles. We talk about importance having a better healthcare for about 50% of world's populations. We talked about importance to have equity in healthcare and also develop further gender medicine. We talked about FemTech development and also the challenge of getting more funding to scale FemTech solutions. We also try to illustrate FemTech market as a growing trend. It's actually a very interesting investment opportunity for a lot of investors. And we also discussed about women's health in global South countries, different challenges, etc., etc. So today, it's a whole a complete different topic. It's about women's health at workplace. Next slide. So actually, through today's events, we would like to showcase the 17 startup projects that are in our current cohort of acceleration. And you will have the opportunity to discover their opinion on women's health at workplace, and also their solution that could contribute to the well-being of all female employees. Next slide. As we all know, women all experience cyclic hormonal changes due to menstruation, pregnancy, and menopause. Women's biological changes can affect concentration, productivity, and energy level. Some women also experience severe physical conditions and also women-related diseases such as breast cancer, endometriosis, postpartum depression, incontinence, etc., which leads to inconvenience or even long sick leave from their workplace. So understanding and respecting the biological changes women experience encourage a woman's workplace culture where every woman can be herself without having to hide or downplay what she's going through. And taking care of one's health at work is more than just a matter of well-being. It's about respect, about support, about acknowledging the unique contribution of women brings. So companies that prioritize the health of their female employees create actually an environment where they can feel valued, understood, and supported. This could boost innovation, loyalty, and can even reduce health-related absence, making it a win-win for everyone. So this is also a concrete measure to support the career development of their women employees. Next slide. Next slide, Amalia. In what follows, you will listen to 4 panel discussions. The first 3 are dealing with women challenges experienced at workplace for different age group of employees, as well as related solution offered by FemTech startups. The last discussion is dealing with the important topic of how employer can better support women's health, illustrated by the best practice of our events partner SICPA. So without further ado, I would like to hand over to Amal, our colleague from SICPA, to guide you through today's roadshow and discussions. Please, Amal.
Thank you, Lan, for your introduction. Welcome, everyone, and thank you for joining us today. My name is Ama Rabani. I'm part of the SICPA corporate communication team. Over the next few hours, we will be discussing on how to support women's health in the workplace. I am happy to be moderating today this topic, not only because I am a woman, but because together today, we will get insights and discover innovation from experts who are helping this innovation to be known, used, and helpful for women's lives. Before to start, let's introduce the host and partner of this roadshow, SICPA, to our external guest. SICPA is a Swiss private technology company. It was established in 1927 by Maurice Hamon, and now is owned and managed by Philippe Hamon, his grandson. SICPA is best known for protecting the majority of the world physical banknotes. With operation across 5 continents, his platform for sovereignty delivers sovereignty solutions across digital identity and integrity, revenue mobilization, natural resources, health, and brand protection. As a global world leader, SICPA is committed to the well-being and health of its employees. And the International Women's Day initiative is part of one of his corporate, social, and responsibility approach. So it makes sense today for SICPA to support the FemTech Accelerator Tech for Eva. And to make move on the discussion, to be a partner and host for the first time at SICPA, the Tech for EVA Roadshow. As announced today, we will have the opportunity to hear online startups that are part of the Tech for EVA incubator and experts committed to women's well-being. They will share in 4 discussion panel sessions their innovation for women's health and provide us a comprehensive overview on how employers can support women's health. They will also interact with you at the end of each panel session, so please don't hesitate to leave a question during the discussion in the comment section. Okay, so let's start with the first panel session focused on menstrual health, reproductive, and maternity, moderated by Sapna Rao, Virtual Care Business Development at Philips. Thank you, Sapna.
Hello, everyone. Thank you for having me and for giving us this platform and forum to talk more about women's health. As Amal mentioned, my name is Sapna. I work in strategy and business development at Philips, where I focus on virtual care. And women's health is a passion area of mine. I've had the wonderful opportunity of mentoring our Tech for EVA cohort over the past couple of years. I'm joined today by a series of experts and inspiring innovators, Hadass Siso, who is founder and CEO of EndoCure, which is a startup that leverages the power of AI in ultrasound to improve diagnosis and treatment of endometriosis. Ante Kern, who is the head of sales and marketing at VivoSense Medical, which uses core body temperature as a biomarker to develop high-precision, low-effort medical diagnostics for women's health. Ashley Crafton, who is an obstetrics nurse by background and CEO of Galena Innovations, which is developing a medical device to prevent preterm labor, which impacts 10 to 15% of all births. And last but not least, Leslie Gotham, CEO and co-founder of Harmonia Healthcare, which is a platform that combines functional medicine with science-backed resolution for underdiagnosed and undertreated and often dismissed female health diseases. Thank you all for being here with us today. We're so excited to learn from you. I have a few questions prepared, but then also would love to incorporate questions in the chat. So please do share away or ask away if you do have questions. My first question, and maybe Hadass, you could take this one, is what are some of the main challenges faced in menstrual and reproductive health, and how is health technology working to address these?
Thank you, Sapna, and thank you all for this opportunity. So I think the main problem with menstrual health that it's been a taboo of women for many, many years. We didn't talk about it. We didn't complain. Specifically for endometriosis patients, it was like a stigma that the period should be painful, and it's not clear to what extent because it's very personal. Those patients are often misdiagnosed and suffer for years. And also when they do have eventually the diagnosis, they will not tell you about it. So regarding the workplace, usually the employer is not aware of the situation and is just experiencing what is going on with his employee. She's taking a lot of absent days, sick leave, and so on. And I think there's a gap in the communication there. So I urge both sides, yes, both the patients, to be, it's not their fault, they can say they have endometriosis. And I think once the employers will understand that, they can be more flexible with them. From my own experience, I had an employee with endometriosis in the past, and when she felt well, she was so enthusiastic. It was so important for her to succeed. So in the time she felt well, she did more than anybody else. So just be flexible and measure the employees based on their success, not based on the minutes that they are working. I think this is very important. The other thing that I think relates to what we are doing here in EndoCure, we are actually having a platform for disease management. And with that, we will enable the physicians to react on time for recurrence and progression of this condition eventually leading to better care and the quality of life for those patients, hopefully enabling them to function better throughout their lives.
Thanks for sharing, Hadass. I think a similar question around main challenges for maternal health and how health technology is addressing these. Maybe Ashley, you'd like to take that?
Yeah, you know, there's a big push right now for changes in maternal health worldwide. But there's really 4 things that have to happen in order to see the changes that we're all pushing for. And that is innovative diagnostic tools and solutions in the 4 most prevalent and damaging issues facing pregnant people today. Those include mental health disorders of pregnancy and postpartum, gestational hypertensive disorders, postpartum hemorrhage, and spontaneous preterm birth. Those have the most lasting and devastating effects on maternal health as a whole. And until we solve those specific issues, we won't see the changes that everyone is pushing for. And that is what will really drive the needle to change for mothers.
Thank you, Ashley. I wanted to invite Leslie also to comment on the same question around challenges and maybe given maybe Harmonia's perspective, how you see health technology working to address the challenges.
Yeah, I think some of the things that others have mentioned around diagnostics, prognostics, anything that can facilitate an earlier intervention. For us, we always think about things in terms of health and economic outcomes, and economic being not just cost to the system, but cost to the woman and the employer. So for us, we focus on treating hyperemesis gravidarum, of which patients are having severe nausea and vomiting. And the average woman misses 23 days of work, and someone with hyperemesis gravidarum may actually miss the entire 9 months of duration of pregnancy of work. So it becomes a really devastating and profound impact on the mom, employer, as well as the whole family.
Thanks, Leslie, for sharing. We know that delayed diagnosis, lack of documented research due to the gender health gap are often cited as major challenges in the women's health space. Maybe I'll start with Ante for this question. What sort of innovation is making diagnostics and information more accessible, information about the female body more accessible?
Yeah, sure. Happy to answer that question on behalf of maybe VivoSense Medical, our company. So we are using the biomarker body core temperature as one of the most crucial biomarkers to detect several diseases, but mostly to detect whether a woman's cycle is a healthy cycle or not. So we know, and I'm sure that every one of you has a friend or a young family who's struggling with infertility or cycle hormonal diseases that affect fertility. Our technology has taken the, let's say, very common method of taking the temperature as detecting a fertile window and ovulation by measuring continuously. So we have 288 data points during one day, which we then analyze and detect cycle patterns that show us a lot of symptoms. And we do a lot of research also in terms of inflammatory diseases, autoimmune diseases, besides detecting fertile windows and ovulation. So what's the advantage for women in workspaces? They have access to their individual cycle health, which means even in worst cases, and I have a very good friend who's undergoing an IVF at the moment, she and her doctor, who has access to that data, can really pinpoint treatments. We can pinpoint maybe other treatments around hormonal diseases. And we are right now doing research on how stress affects cycle health as well. So together with a lot of women who are taking part in our research at the moment, we can learn a lot about how to detect early signs of stress and how that may affect the whole cycle health of a woman. And she can really plan around these events and act around those stress factors, and really takes action also at her workplace, as an example.
Thanks, Ante. I'm appreciating how what you're sharing is really around empowering women with the insights they need to kind of make more insightful, sort of backed decisions for themselves. A question really to anyone that would like to share. What about the role of the employer? So we're talking a lot about conditions which might be unseen, so a little bit less likely for the employer to kind of be able to know about them. What is the role of the employer in supporting their employees that are experiencing these health challenges? And why do you think it's so important that they do so?
I'll speak to this one kind of from a maternal health perspective, but every pregnancy starts out in a uterus, and so all of this is a health issue that affects all of us. Women's health is not just about women; it's about families, it's about communities, it's about society. And one of the things that we see, even with preterm birth, having a stressful work environment, and the conditions surrounding your work. Things like how long you stand, how many hours of work you week, how stressful your work environment is, completely affects spontaneous preterm birth. Those rates go up with a more stressful work environment. On the flip side of that, what ends up happening after a spontaneous preterm birth is that the work output for that woman completely changes, and the burden on the employer becomes a lot greater, specifically in places like the US, where usually insurance is provided by a provider. Now they have a child that has asthma for the rest of their lives. They have a mom who is now not just out for a regular amount for maternity leave, but for years. And we have a mother that will never be able to climb out of the poverty or the issues that have been placed on her back because of the financial burden and the burden of having a child with disabilities. So the sad thing is it's kind of a repercussion back onto the employer. And so ensuring that healthy pregnancies happen is actually ensuring the longevity and the work output for that individual as well. So it's kind of a two-way street, I feel like. When we support healthy pregnancies in particular, we support healthy communities, healthy families, healthy society.
Ante, did you want to add? Yeah, go ahead.
Yeah, it's just so great what Ashley says. I mean, she's been talking also about a lot of data and a lot of actual costs that are a great burden in for example, in the United States, but also looking globally and maybe Europe and Germany. I think we should all talk about prevention, and prevention can only happen when we have data and when we start talking about costs and pain and really data that is happening and that has been happening over the last decades, since women are actually eligible to work full time, or as much as they want. And it is so important to speak up, to offer safe space, and also, in my opinion, to take the lead. We are fighting for A-level positions here as females, and in A-level positions as females, we should talk about our cycle health. We should talk about stress, and give our employees the chance to find a safe space to discuss and then prevent. I mean, Germany has a lot of great insurance companies who are strongly connected to employers and who run programs. I know a lot of female entrepreneurs who have made period health and cycle health as their as their core business model, who would go into companies and have lectures, and those women, they get paid for showing awareness and giving those very important, let's say, inspiration into workplaces. And I cherish that. I totally love that. I support those girls.
Thanks for sharing. While employers are slowly expanding benefits, and I think, Ante, you gave a great example of menstrual health, which, you know, I don't think yet is as common. I would say expanding benefits into maternal health, fertility, and lately menopause seems to be kind of where employers are focused. The full spectrum of women's health needs, though, are yet to be recognized. What will it take to make access to such benefits more available? And what are some examples that you're seeing that's driving this space? Again, a question for anyone.
Yeah, I actually think policy, which is obviously dependent on country, but for example, in the state of New York, they just recently passed legislation that supports pregnant women can take a certain number of hours off of work to see their physician and seek care while they're pregnant. So there's certainly an intersectionality between policy and employers that help facilitate and encourage women, not only having access, but actually encouraging them to take advantage of the services that providers can offer to actually get them in a good state of health.
Wonderful. I see we're actually up at the end of time. It was a short but sweet panel. So wanted to give all of you the opportunity to share maybe one thing you want those listening to take away from the panel, maybe a call to action. We can start with you, Hadass.
Yeah, I think that awareness for specifically, I'm in the field of endometriosis, but I think for all women's health related issues, the awareness could be better. So like I said before, I think it's for both sides, both the employees and the employments, to talk about this, to bring it to the table. Like all of you said today, it should be also policy that backs up all the sensitive situations that we go through our lives. And I'm actually happy that there are more women CEOs and employers that, you know, we understand from firsthand what those women are going through. So I think the change is coming.
Ashley?
I would ask of people, a call to action would be just make any step. Any step is a step in the right direction. I think women are so cognizant about their employers and what they're doing, and we applaud and are grateful for any step.
Thank you. Leslie?
I'll use our tagline, which is hearing her in healthcare. So I think acknowledging how women are feeling, providing them access to care, and actually acknowledging and not dismissing symptoms that they're feeling.
Thank you. And Ante?
I would probably add that every woman who has a colleague should start forming groups, finding allies, speak up, and never use the word niche again in that in that really, really big topic. Yeah.
Thank you to all of our panelists. Really great discussion. And thanks again, Tech for Eva and SICPA for having us.
Thank you, Sapna, and all the speakers of this panel. Thank you so much. Thank you for sharing with us all these experiences. As announced, each panel will be challenged by speakers. So now I have the pleasure for the next panel to introduce Anne Legmond, Vice President of International Marketing at Embecta, as the moderator of the Prevention and Oncology panel. Thank you, Anne.
Thank you so much, Amal, and welcome to the second panel of today. So a warm welcome to everybody. We now have the pleasure to gather some truly impressive startups in the area of oncology and prevention. So as mentioned by Amal, my name is Hannah Langman. I'm currently working at Embecta, a world-leading medtech company in the area of diabetes and insulin treatment. And we're based not far away from the SICPA office in Lausanne. We are close to Nyon. So today, we estimate around 20 million new cancer cases per year worldwide and almost 10 million deaths. In Switzerland specifically, these numbers are around 45,000 new cases per year and almost 17,000 deaths. And unfortunately, we expect the number of new cancer cases worldwide to go from currently 20 million to over 35 million cases by 2050, which is of course significant. Now, two of the most common cancer types for women are breast cancer and cervical cancer. 1 out of 8 women worldwide will develop breast cancer at some point in time through their lifetime. And as we know, Pink October, October is the month as well of breast cancer awareness. So I'm sure that you see many of your friends and colleagues maybe wear a pink ribbon during the month to raise awareness around this important topic. So again, today the topic we're covering is highly relevant. So if we turn to the panel we have, so I'm going to ask my first question to Omid, who is the founder and CEO of Namida. So Omid, your company works with employers, insurance companies, and individual customers within the area of breast cancer screening. What are the barriers to improving breast cancer screening today, and how does Namida help solve for that? And also, if you have any thoughts on how employers can play an important role in that area, that would be much appreciated. So Omid.
Oh, thank you. In our research, as we were developing our product, we saw that issue of access and convenience were very important. The ages of where breast cancer affects women, even though it's growing to younger population, it's usually typically in prime working years of a woman, and also family formation, taking care of children, taking care of their career, taking care of a family, and maybe even aging parents. And usually women put themselves last in that list. And the issue of convenience, because we have created a complex method of screening for breast cancer that requires visiting a radiology clinic and making it a separate appointment from the typical visit to a physician that's usually an OBGYN or a primary care. And that issue of convenience is actually one of the most important factors, and access. There's a lot of cultural reasons too, various countries, various cultures. For example, one of the groups we work with in Southern California, they have a large Hispanic population, and Hispanic women just do not want to bother their families typically. So they skip their screenings. And as a result, their cancers are found mainly in later stages. Saudi Arabia, they've had free mammograms available for 30 years, and uptake is about 6.5%. And so there are many different reasons depending on the culture, depending on the group, but in reality, we need to have a less complex way of screening. And it was an accident of history that radiology came first, so that established itself as the rule. Perhaps if biomarker testing was discovered earlier, lab testing would have been a way to screening. So what we have is a lab test. We have a lab test for screening for breast cancer. And it's a convenient lab test. It's a kit that goes to the home, and the sample is collected and sent back to our laboratory. And then everything else is managed through our patient portal and digital health tools. Now, employers have an incentive to catch cancers early, because last year, for example, National Business Group of Health in the United States showed that cancer is the #1 spend for US employers now. And many breast cancer is actually #1 among the cancers in terms of costs. And later stage breast cancer costs more than $1 million per case. And half the mortality in breast cancer in the United States is in women under the age of 45. Again, very experienced employees, very experienced in the prime of their careers. And so employers have an incentive of finding cancers earlier, both for costs and for reasons of keeping their workforce healthy and working. And we work with them. We work with a number of employers. As a matter of fact, I just got the kit for Princeton University delivered today. And so these kits go to the employees' homes and they come back to us, very convenient for collection. And so we have created the Gordian knot in terms of screening for cancers. And the only way of dealing with the Gordian knot is basically cutting through that complexity and making access easier.
Thank you so much for sharing, Amit. And you know, having access does not mean that people will use it. There needs to be the combination of access and convenience in order to really find that magic formula. So thank you for sharing. Now, a natural step after the screening would be to make sure that we properly diagnose breast cancer. And so this is why my next question, I'll direct it to Marisa, who is the CEO of Deep Look Medical. So Marisa, what are still some of the unmet needs in this diagnostic space? And how is your company uniquely helping to address this?
Yeah, so I mean, listen, as Amit said, that screening and imaging and radiology is still standard of care, and it is still, you know, what everybody is doing. So, you know, screening as far as a mammogram and ultrasounds and all of that is still necessary. And it's great to flag the breast cancer, but in dense breasts, you can't see it. And with 45% of all women affected by dense breasts, which they can't do anything about, it's just how, you know, how they're built. And it doesn't allow the visualization in a mammogram and ultrasounds and MRI, and that's a problem. And so what Deep Look does, our flagship product, DL Precise, helps to visualize at a lesion level very specifically, reliably and repeatedly, these lesions. Because honestly, screening is the #1 tool. It is the standard of care around the world, and it will be for some time. And I absolutely do hope that diagnostic testing and other types of testing besides X-ray technology does start to evolve. But in reality, for the next 20, 30 years, that is going to be standard of care. And so there needs to be additional tools in the radiology world. You know, they need tools to be able to see and to, you know, pun intended, take the deeper look into mammography and into ultrasounds. And as far as diagnosis goes, you know, there's multiple steps when we're talking about breast cancer. First is the screening mammogram. And then 28% of all of the 42 million mammograms that happen in the US, 28%, that's 12 million just in the US alone, have recalls. They have to come back for supplemental screening and additional screening and ultrasounds and MRIs and diagnostic mammos and biopsies, most of which are unnecessary. And so if we can reduce the number of unnecessary recalls for all of these screens and diagnoses, that's exactly what we need to do. And that also helps the workflow at work, the workplace and employers, because every time you have to have a recall, that's another few hours out of work, and for every single step, and they don't happen sequentially in the same day. And so for a woman and the family, it's anxiety. And you know that a woman who receives a notice is not going to be performing optimally at work. And so if we can reduce that, and we've shown in our evidence generation studies, 12% reduction in recall rates, that's quite significant. That's hundreds of millions of dollars out of the healthcare systems, and unnecessary anxiety and stress for the women, which ironically is a cause also of cancer sometimes and cancer growth. And so if we can reduce the recalls and use these diagnostic tools better in the radiology sense, then that's very much what we do at DL Precise. With DL Precise.
Great,
yeah.
thank you. Thanks for sharing, Marisa. You know, I think what you're touching upon, which is really interesting, is this link with stress linked to you know, recalls of results, needing to go back to the doctor. Maybe there's something wrong with me, but maybe there's nothing necessarily wrong. So is that unnecessary stress that creates both in the workplace but also in the family life, where tools like this can really help. So thank you for that.
And time away from the workforce.
And absolutely, absolutely. So as I mentioned in the introduction, cervical cancer is also one of the most common cancer types for women around the world. So I'm going to direct my next question to Ronald, CEO of CC Diagnostics. So Ronald, welcome to the panel.
Hi.
Your company has developed a diagnostic tool that helps to identify cervical cancer earlier. Now, before going into what your company can offer in this space, maybe you can just give us a bit more background on what is cervical cancer, how can it be prevented, and maybe do you see a specific role for employers like SICPA or any other company? What role can they play to help advance solutions like yours?
A very easy role, and thank you for the intro, Hannah. Well, cervical cancer, I don't need to introduce that. I guess everybody knows it's typically caused by HPV infection. It's actually one of the cancers that we can prevent very well. Adequate screening, vaccination. So what is actually the issue here? Well, screening or screening intervals are based on health economics. So if you screen once per 5 years, you miss a number of women. They will get cancer, they'll need treatment, and they might die. So screen more often, you would say, but if you screen every 2 years, it becomes unaffordable. So it's a fine balance between how many lives can we lose and how many people will get sick and maybe recover from that in what we can afford. So the solution is pretty simple. Make the screening technique such that it costs less. Then you can do shorter interval, you catch more cancers early and you save more lives. With the current methodology, it doesn't work. So our test, it's called MEFICA. It's a triage test, so it's like the pap test. So we're following up on HPV positive samples. But where the pap test is at 75% cancer detection, we are at 97% cancer detection. And our test can be applied on the sample that you need anyway for the HPV test. So nowadays, women can take from their privacy of their home a self-collected sample, send it by regular mail for testing. If then positive for HPV, you would normally need to take a day off or a sick day and visit your gynecologist for a pap test. What we suggest is that you first run our test in the lab and see indeed, if negative, repeat the screening next year, then you're good. If positive, you go and you plan that visit and you go, and even if it costs you a day off, you make sure you go. Now, changing screening programs takes massively long because they're governmental controlled. So what can employers do? Well, I worked for a company and we were offered like a full body scan every year, but it could be paid from your gross salary. That goes a little bit far because that's very expensive as well. But now they often provide for free fitness club access. So why not pay for a screening test, which is not that expensive, maybe once a year? Then you change from every 5 years to once a year. It's not that costly. 12% of women are positive for HPV. So normally the 12% of the women in your company would need a follow-up, say they will be away from work. But with the test, we can actually reduce that massively. And when there is cancer or pre-cancer not detected, which is very often, there was indeed no need for the follow-up anyway. So now imagine that you're an employer and some of you are employers and you can implement this and you save maybe one employee the route from anxiety after the positive diagnosis, the aggressive treatment, and potentially death. I feel that it's worth considering for employers to implement something like this. So.
Yeah, thanks for sharing, Ronald. I think this regular screening is key. I think we all know it, but the question is then access to care and the cost of that. And sometimes we literally just forget, right? It's something that we need to put on our calendars as a reminder as well. Go to the dentist once a year and do your cervical cancer screening once a year.
Yes.
So I want to shift gears a bit and move into the space of medical research. So in the healthcare industry, we sometimes talk about the gender bias that exists, which is basically claiming that men tend to be typical default subjects in medical research, which then creates standards that does not always apply to women. Now, this focus can potentially result in overdiagnosis and overtreatment in men, but then also underdiagnosing and undertreating women. So for my next question, I'd like to turn it to Marie-Agnès. I know this topic is close to your heart. So Marie-Agnès, what are your thoughts on how companies can create a culture in the workplace which helps address this gender bias that we see in medicine, and how is your company supporting in this area?
Yeah, thank you so much. This is indeed a very important topic. And I think companies can implement a culture of active prevention and information. It is extremely important, I think, to make men and women aware about this bias, the impact on their private life and their professional lives. And second, to propose interactive sessions where it is possible to discuss openly and identify the causes and solutions to counteract this gender bias. And finally, I think companies could also engage male collaborators in task force because they are very much willing to change that. And the cause of this bias are multiple. This is very important to keep in mind. So it is linked to lifestyles, environmental and cultural factors, and also to biological factors. So prevention, early diagnosis, and high quality care are the three dimensions to leverage to help women and to which companies can contribute. So I will give specific example now. So prevention, I think we could encourage collaborators and their families to take part into events. There are multiple events. Early diagnosis, discuss the impact at the workplace, concrete access to diagnosis, and also to innovation. We have multiple innovation that are proposed by this cohort of Tech Forever, and also that will help the next generation. So let's discuss openly about them at the workplace. And finally, high quality care. So join specific medical network to provide concrete guidance and support, spread information about recent therapeutic advances to deliver a message of hope to families and to women. So at Calico Biosystem, we develop innovative approaches to identify the best treatment for women in the field of cancer. And I think it is very important to make women aware about innovation. Clearly, women like to hear about new things, spread the message of hope about innovation that can help their care. Thank you.
Thank you for sharing. I think in today's environment, it's difficult to do a panel discussion about healthcare without talking about the role of AI. So this is why I'm going to direct my next question to Adi, who's the founder and CEO of CareNX, as to how they're leveraging AI in their solutions. So Adi, your company's mission is to create equal opportunities of care for women through AI-based solutions. Can you talk a little bit more about that, and how does this manifest itself in the workplace?
Sure. Thanks, Anna. So first of all, I would like to break this question into two parts. First is role of technology and AI in order to enable equitable access for women care. And second, systemic change the technology might cause, which enables equal access of care to women. So in the first part, we have developed an AI-based cervical cancer screening technology, which can be used in underserved areas, low resource settings, where doctors would be able to detect cases which are not typically visible through naked eyes as far as the visual inspection is concerned. So technology can play a crucial role in terms of representing a diverse population by having a data set, and AI can help us devise that kind of intelligence in order to know that it is appropriate, responsible, culturally responsible, and without bias detects cases for women. In the second part, when we talk about equitable access, first of all, we strongly believe at our company that women should be actively involved in developing technology, and that is why we have our board members who are from diverse background. One of them is a gynecologist herself, another is a health worker, and third one who is actually a biomedical engineer. All of them are women. They understand the problems in depth because of having certain personal experiences. So their contribution in developing technology itself makes sure that we get rid of certain issues which might arrive later. Second is we wish to do a systematic change, not only develop technologies, and that happens only if we create a positive narrative which will take care of trauma or the fear of not getting diagnosed, because in many cases in underserved areas, women do not want to get screened, do not want to know whether they have, say, cervix cancer, because that is a fearful situation. The narrative that we are trying to change is to say that if it gets detected early, there is a good chance that you can be cured. So it's a good thing to get diagnosed. So that spin of narrative might give us a better position to enable health-seeking behavior across women. And both these things will together achieve equitable healthcare access. That is what we believe in CareNX.
Thank you so much, Adi. I know we're almost at time, but I want to make sure we also hear from our last panel member, so Camilla from Mammotest. I'm going to ask a similar question to you. How are you leveraging AI at Mammotest, and And also, how are you connecting it to both the diagnostic process efficiency, but also the navigation and support for high-risk patients?
Thank you very much, Hannah. So yeah, contributing to what our colleagues have very well shared, the patient journey of women during breast cancer or gynecological cancer screenings and diagnosis is still very challenging because it takes time of work, traveling, logistics, appointments, emotional stress, and money. At Mammotest, we use AI to address breast cancer diagnostics holistically by improving accuracy, efficiency, and accessibility. So even if we started with a screening solution, we understood that there are many factors that can affect the patient journey after a potential risk, such as informative, economical, or psychological barriers. So as we know, timing in cancer, and particularly breast cancer, as the survival rates are very high, if identified at an early stage, is key and really life-changing. So we designed a solution where the application of technology and AI contributes at every step of the patient journey, from awareness and screening access to guaranteeing a timely diagnosis and access to treatment with emotional support from our health navigators. It's an algorithm that supports and makes more efficient the work of radiologists when analyzing breast studies, because it generates a faster turnaround for results to patients by triaging suspicious or risk exams from normal. So the work list of radiologists is organized and they can make better use of their time, contributing to the global shortage of radiologists worldwide. And then AI in patient navigation helps our navigators that are psycho-oncologists, social workers, nurses, or any healthcare professional, with the automatic identification of risk patients, considering their screening results and identifying their barriers. So we use natural language automation to make the process more efficiency by providing informative advice to the patients, such as the closest centers for their next study, depending on where they live, their medical insurance, and the urgency of their needs, leaving more specific, sensitive, or maybe complex advice and support from for non-automated advice from our health navigators. Our evidence shows that risk patients have significantly reduced their times from screening to treatment, increase their emotional well-being, and increase also, hence, the quality of life during and after treatment. So I think that AI will not, at least for the short time, replace healthcare professionals, but can definitely support decision-making, increasing efficiency and quality. And I think that in this space, I like to share that considering an holistic and comprehensive solution for the preventive screening approach of gynecological solutions in workspace is very necessary from the health, economic, and emotional point of view for women.
Thank you, Camilla. Yeah, so we come to the end of the panel. I want to say a big thank you to the panel for your diverse thoughts in this area. And for continuing to raise the bar when it comes to prevention in oncology. So thank you, SICPA and Tech4Eva, for giving us the opportunity. And I'm going to hand it back to our third panel. Thank you.
Thank you, Anne, for leading this discussion, and all speakers for your insights. Our next panel will discuss aging, focusing on wellness and menopause, and it will be moderated by Cindy Rodriguez, Global Brand Director, Disruptive Innovation at Procter & Gamble. Thank you, Cindy. You have your micro off. I can see we are still need some innovation progress for Zoom, I guess. You have the opportunity to unmute. I saw that it's mute. Maybe you can write the first question on the comment section, and by time you're fixing the problem. Okay, so the time we're fixing the problem, I'm curious because we have a participant from all over the world. So if you have time, just write your place or put the tag of your flag just to know where you are coming from. I'm sure we have people from not only Switzerland, but many places. Mexico, whoa. Thank you for joining us.
Do you want me to read the question? Well, I have the questions here for the panel.
Perfect. Yes.
Yep. Okay, so the first question is for Derek. Can you share any stories or experiences that highlight the importance of addressing women's health issues in the workplace?
Hi, everybody. Yeah, I think, women's health and aging, right? So I come from industry. I was inspired to launch Cosm because of a health episode with my grandmother. And in my last job, I had built the most utilized functional urinary diagnostic system in the world. And as part of that work, a famous urologist once told me, the question isn't whether or not a person's pipes are going to break. It's whether your house falls down first. And I think half of all men are affected by prostate issues. Half of all women are affected by pelvic floor disorders, such as incontinence and pelvic organ prolapse. And, at Cosm, we regularly get, messages from patients, whether it's short messages or literally 3-page emails around, can you help us? Sometimes at 3 in the morning on a Saturday. I think when you look at health is a holistic issue. Pelvic health is a part of it. And employers really should be, employers have not only in the working conditions and whatnot. So pelvic floor disorders are highly correlated to physical activity. So women with high physical activity are affected by, are higher at risk of pelvic floor disorders. Secondly, they control employer health benefits. And I think every employer can always ask, hey, what in the women's health field is covered and unique by your insurers? And I think a lot of the insurers are starting to cover new products specifically geared towards women's health, noting that the public system undercovers women's health compared to men's health. So it's exciting to see, and I think that's one of the major things that employers can do. Keep talking, or
The next.
Yeah.
Should I continue, Cindy? Yeah, okay. So thank you, Derek. Jasmine, what are some misconceptions about women's health in the workplace that you think need to be addressed?
Thank you. Just quickly, I'm Jasmine from Hormona. We are reinventing hormone health. And I think there are many misconceptions about women's health in the workspace, and they stretch across a range of different areas and issues, but I specifically want to highlight a couple of things. Firstly, I think there's a huge misconception around menstrual health and the fact that it's considered a personal issue and not a workplace concern. Many believe that menstruation is a strictly personal issue that doesn't impact their professional performance or any of the workplace dynamics. But in reality, menstrual symptoms can be genuinely debilitating for some and hugely affect their productivity. 70% of women say their period has negatively impacted them at work, and the impact of absenteeism in work due to either severe period pain, heavy periods, or dysmenorrhea costs a total of £10.6 billion per year in the UK alone. That's a huge amount of money. And so acknowledging this with, specific policies such as flexible work options or even menstruation leave, I think could lead to healthier work culture where women feel supported rather than pressure to just like power through. And obviously it can also save companies billions of pounds. We also have menopause. I think menopause is rarely discussed in workplace health conversations. And it's often seen as irrelevant to productivity when in reality, 79% of women who experience menopausal symptoms say it affects their ability to concentrate. 68% of women who experience menopausal symptoms say they feel more stressed, and 23% of women aged 40 to 60 consider resigning due to the impact of menopause. I mean, that's tragic. You were at the height of our career and we are considering resigning because we're not getting the support we need. So I think we can see that these symptoms of menopause, they really impact our focus and the well-being of women in the workplace. And finally, I think the final misconception I want to raise is the fact that there is this assumption that all women's health needs are the same. But of course, that's not true. Women's health is highly complex and it varies greatly among individuals. And health concerns can be different for women based on their age, their lifestyle, their cultural background, socioeconomic factors. So tailoring our health policies to account for those diversity, I think can really support more effective and meaningful workplaces. And I think what we've seen in our conversations, because Hormonal Solution does provide support for any hormone-related issues, and that spans across anything from menstrual, reproductive, and menopausal health, is that some workplaces seems to think that providing women-centered health benefits is too costly or unnecessary. But like offering a comprehensive health benefits, including fertility treatment, gynecological care, some of the things we've talked about here today, and support for hormonal health can really be pivotal, I think, in creating an equitable work environment. Last numbers I heard, 40% of women believe that their professional career development has been negatively impacted by the lack of support for women's health issues in the workplace. So I think creating awareness and dispelling these misconceptions can really foster a more inclusive work culture, hopefully leading to healthier, happier, and more productive workplaces for employees. To just kind of round it off, I think the most important thing to remember is that women's health is not a female issue, it's a people issue, and it affects all of us. So I think we really need to recognize that we're all different, but there are companies such as ourselves that can provide the support needed for the different stages of a woman's life. And by doing that, we can hopefully find a way to support a range of these issues in a much better and more effective way in the workplace, not just leading to happier, healthier workforce, but better output for the company and lower costs.
Thank you so much, Jasmine, and I agree with everything you said. Now we have Kritika from Vital Start Health. Kritika, how do you see the intersection of workplace culture and women's health impacting employee retention and recruitment?
Yeah, what a great question. And I have to say, this has been fascinating, all the three panels. Thank you so much, Tech for Eva and SICPA. So let me first share who I am. I'm Kritika Parmeshwaran. I'm the founder and CEO of Vital Start Health. Our goal is to revolutionize women's well-being and wellness, right from reproductive health through menopause, oncology, and other areas for longevity. And we're doing this using virtual reality as a newer modality for next generation of care. And we're able to do that all through insurance in the US. Now, just coming quickly to that question on how employers need to look at retention. The report and the data is clear. For longevity, you need a better quality of life. And the McKinsey report, for instance, was very clear that 25% actually of women are spending higher rates in poor health than men throughout that health span. So something definitely has to be done. And I think employers are right in the midst of all of this because women make 50% of employers' workforce and productivity is huge. So one of the ways, when you look at this and you look at the numbers, we know that, say, just with fertility, 88% of employees have said that if they can get those benefits and they can get support, they will be more loyal and they would have that retention. The employer would have retention. We know that a preterm preterm birth can cost $77,000 in the US on average, and definitely employers are facing that in their bottom line itself. So it's very clear that not just reproductive and maternity issues, but like Jasmine mentioned, menopause, oncology support, all these other areas definitely need attention and have clear data backing this. So I think employers, this is a call to action for every employer out there that something can be done to improve the literal bottom line for that employer, right, in terms of productivity, in terms of having a better workforce, and that is by focusing on women's health.
Thank you so much, Kirtika, and I also agree with everything you said. The last question is for me. I'm Gabriela Rojas from Sin Reglas. We're a digital community that works to transform the experience of menopause for all women. And we work directly with women, but also with companies to create inclusive workplaces for women in menopause. So the question is, why do you believe women's health issues in the workplace have been historically overlooked? And what changes are you seeing? Or how organizations can create a more supportive environment for discussing women's health issues? So Jasmine and Kritika have already talked a little bit about this, and I would just like to add several things. So why women's health issues in the workplace have historically been overlooked for several reasons. The first one is gender bias and stereotypes. So traditional gender roles and biases have led to women's health concerns being marginalized or even dismissed. The second is lack of representation. Historically, men have dominated leadership positions, and this has resulted in limited understanding and prioritization of women's health needs. Also, stigma and taboo. This is like huge. Women's reproductive and menstrual health have long been stigmatized, making discussions and advocacy challenging. For example, in our data, we see that 8 out of 10 women don't feel comfortable talking about these issues in the workplace. And they don't feel comfortable talking about this also with the doctors. So this taboo replicates itself in the workplace, in the office of the doctor, but also in society in general. The next one is workplace culture. So traditional workplace cultures often prioritize productivity over employee well-being, neglecting health concerns. And as Jasmine had said, this not only affects women, but affects the companies and affects the society in general and the economy of a country. So this is why we should all care about these things. Some of the key women's health issues that have been overlooked in the workplace include menstrual health, pregnancy accommodations, breastfeeding, menopause symptoms, and accommodations for menopause, but also reproductive health and fertility, and mental health and stress management. What can we do to address these gaps? Well, employers can implement policies and practices to support women's health, such as flexible work arrangements, access to healthcare and resources, which is really important. Because if women are supported, they can actually be productive and they are at the climax of their careers. So no society can actually lose the talent of half of their population at this stage, at any stage. Also, training and education on women's health. And this is super important to include not only women within the workplace, but men, women of all ages should have awareness workshops and training. And also creating a supportive and inclusive work environment, which is really important. So if we acknowledge and address these overlooked issues, workplaces can actually foster greater gender equality, productivity, and overall well-being for all. So I think with that, I don't know if anyone wants to add anything.
One very quick thing.
So first of all,
oh, Cindy, you're back. Okay.
Yeah, first of all, I
can over to you, Cindy.
So thank you very much. Thank you very much, Gabriela, and the panel, because you have been a wonderful self-directing panel. And well, first of all, thank you very much for all your insights. I'm very, very happy to see all the progress that you guys are doing on how to create more tools so women can have better well-being, can talk about their issues, can really feel supported in not only in the workplace, but also on their personal life.
And well, what I would love to learn from you more is that what you believe is the big challenge ahead of us. What do you think is the next big thing we need to do to empower women to deliver on these wonderful goals?
I did have a thought on that, Cindy, and you really picked up on it. And I was thinking, since Vital Start, initially we focused on maternity and reproductive health, there are these designations provided to health systems that you are a safe place to give delivery. There's the blue designation. There is all these other things for breastfeeding and so on. We need a designation for every employer that they are women's health friendly. There should be something. Tech for Eva, LAN, this is a call out to you. Maybe you need to come up with an accreditation that an employer can put a stamp saying that they are pro women's health. And those who don't, then shame on you. So we need that. We need a way to really remove the stigma, make this so powerful that no one in the world can ignore this problem.
Yeah, it's an excellent idea. We think about the solution to have a stamp, like a certified company. Yeah, certification company taking care of women's health. Great idea. Yeah, thank you. Thank you.
And what about the challenge of awareness? Because something, and I can talk a little bit about that one. Before becoming a mentor at Tech Forever and learn from all of these wonderful startups that are pushing the boundaries of FemTech, I didn't know many things even about my own body. So what do you think about that challenge, Gabriela, or you guys, any in the panel who wants to jump in?
Well, I think that's biggest and the first hurdle for everything else. We need awareness of in women, but also in men, and women and men at all ages, and awareness for leaders in organizations and for governments and for academic institutions. So all of us that are working, for example, on menopause or fertility, I think we have that first hurdle, which is awareness, because not even in some cases, not even women, not even us, we're aware of, for example, menopause symptoms, right? In Mexico, it takes around 1.5 years for women to actually identify that they're living through perimenopause, no? So if you're not aware of those things, it's difficult for you to actually talk about it and ask for support in your workplace, for example. So we need to do a lot of work in our societies to make everyone aware of all these women's health issues, not only menopause, but fertility, but maternity and paternity and all these issues, and also other health issues that affect predominantly women that have been overlooked, or that affect women differently, that also have been overlooked. And for that, we need awareness. I think that's like the first big challenge we're facing.
Yes, Derek, you wanted
just wanted to jump in here because I second everything that Gabriela is saying, but I think it's even more, it's a societal problem. We've had this gender health data gap that's existed pretty much forever. So, it's on every level. We need to take a step up in the workplace, in our daily life, but also like within medicine and the data that we base some of our treatment options and things on. And I think programs like this, or like raising awareness across a range of different areas, is the only way we can do that. And I think we all share that drive. And I think wherever we go, we keep like raising this with anyone we talk to. And I think everyone needs to do that for it to be a permanent change.
Yes, and Derek, did you want to add something to the panel?
Yeah, and I think starting with awareness, but really this drives towards payment models and how devices and everything are funded. There is literally published research both in Canada, US, and elsewhere that the same surgery for a woman versus a man gets paid less. This needs to change. Doesn't make sense. And I think it's exciting to be part of this group, driving change both on a technology and other components, and the institutions of, let's say, employers, governments, and whatnot bringing awareness to the delta between reimbursement in men's and women's health is necessary for us to bridge that gap, because that will eventually fund more innovations like us as we go forward. So.
Thank you very much, Derek, for adding, and thank you very much to all of you for first participating in the panel, sharing your thoughts, for all the work that you are doing to really close that gap between the reality that women are living today, like all these difficult situations that they are going through, and creating those wonderful solutions that can enable better life for not only for women, but at the end for all of us. Finally, I want also to thank all of you guys in the audience for being here and being the first ones to educate also yourself in all of these different solutions. You are our first advocates, and we hope you can spread the word too, to continue raising awareness about all of these topics. So thank you very much. And with that, let me hand it over for the panel number 4.
Thank you. Thank you to all the speakers. Thank you, Gabriela and Cindy, for leading this discussion. Okay, so let's jump to the last panel of this event. Our speakers will share with us their experiences, case studies, and their vision to explain us how employers support women's health. This session is led by Lara Rossi, PR and Media Manager at SICPA. Thank you, Lara.
Thank you very much. Can you all hear me?
Yes, we hear you.
Very good. So thank you to the previous speakers and very insightful presentations. I'm now very happy to welcome you in this last panel discussion focused on how can employers support women's health, with my colleagues Almudena Perez, SICPA HR Manager, Juliana Voleri, SICPA Talent Acquisition and Employer Branding Manager, and the consultant Monica Zielonka, consultant in innovation, Secretary General at Women in Tech, and consultant for the association Cursus Formation, which is based at the SICPA Unlimited Trust campus here in Prilly. Good afternoon to all, and welcome in this panel discussion, Almudena, Juliana, and Monica. Here is a little bit of context before we start with the questions. So over the course of their lifetime, women go through specific health challenges impacting their well-being at work, as we just saw with all the panelists before. Many companies are supporting women in their health and have developed specific tools to support them in many aspects. So my first question today goes to you, Monica. What are the main health challenges faced by women in their workplace?
Thank you very much, Lara, for having me on this panel. First of all, I've been following Tech for Eve since its creation, so I'm very happy to be here and very honored. And I echo what has been said before. Bravo to SICPA and Tech for Eve for running these initiatives, because these initiatives not only help us develop innovative health solutions for women, but also, yes, do raise the awareness of what is possible. And women sometimes may not be aware themselves of that. So a lot of topics we mentioned in regards to, can you hear echo? I hear echo. I'm not sure what is causing.
Yes, I can hear you.
A lot of topics have been mentioned, from maternity issues, menopause. I would like to concentrate today on a topic that was touched on also, which is stress in the workplace, the burnout, feeling stuck and lack of support sometimes. So what employers can do in regards to is to show within the organization, to show women that it's possible for them to advance. So I see the message about the echo. You still hear it? Is it very distractive?
Sometimes it cut a little bit, but I think it's okay.
Okay. Maybe you have 2 devices at the same time, so create some echo.
I have only one, actually.
Mm.
Okay, go ahead. We can hear you. Anyway.
So one of the examples what employers could do for women, it's really champion women into management role, champion women into more higher leadership positions, for women to see that it's also possible for them. So they go into that mental state of feeling like they feel motivated, engaged, they feel confident that one day they can see themselves also in those roles. And that ultimately create that feeling of well-being. Also creating mentorship programs, that works quite well, and allyship programs, where what it means is that people are seeing men or women see things from women's perspective, from minority perspective, understand what it is. How is it now? Is it still very disruptive, the echo?
No, right now is okay.
Yeah, okay. And what women can do themselves, actually, I believe there's a lot of women can do themselves that I observe working with women, helping them to understand what their unique strengths are, because this help to build their confidence and help to fight the imposter syndrome that we talk a lot about, that this is quite common to women. And in order to do that, we need to understand what our unique strengths are. And it's often, these are the things that comes very easily to us, very naturally, and we disregard it as something just ordinary. But these are exactly the building blocks of our potential. You may think that it's easier said than done, how to do it. You can ask your friends, your colleague in a workplace to find out what your strengths are. Not your weaknesses to improve upon, but what are your true strengths. Why it really matters is because it builds that confidence. No matter what goes around you in a workplace, no matter in our imperfections or failures sometimes, which happen to everybody, it helps us to stay strong at the core because we know exactly what we are good at and what our value is. And that also helps us to reach out to our sponsors, which are very needed for women to feel strong in a workplace, confident, and help them advance their career. It's also having a sponsor in a workplace, build that relationship, to have somebody who will advocate for you behind the closed doors. Thank you.
Thank you very much, Monica, for your insightful answer. I'm now turning to you, Juliana and Almudena. As member of SICPA HR, how does SICPA support women's health? We can start with you, Juliana.
Thank you, Lara. I'm happy to take on this question on behalf of the SICPA HR team. I see among the participants there is a great global representation. I saw people from all over the globe. And to start, I'd like to mention that SICPA is an international company with offices in 35 countries across 5 continents. We do have global programs, global standards in place. However, our approach to addressing these health challenges may also vary across regions due to local regulations, local practices, as well as cultural aspects. At SICPA in Switzerland, because I'm based in Switzerland, we are providing a certain number of benefits as well as working on a certain number of initiatives to support employees' health, both physical and mental. Most of these initiatives are available to everyone, men and women alike, without distinction. Some are specifically tailored for or mostly used by women, given the unique needs that we may face in the workplace. I would like to give you some concrete examples, starting with some basic ones that I believe all companies should provide nowadays. First of all, SICPA contributes to the health insurance through a financial participation. We also provide a collective insurance agreement that was negotiated for SICPA employees, which includes some supplemental health insurances, and which also comes with a more important financial contribution. When it comes to maternity, because I saw this is an important topic, and it touches some of us at some point in our life. SICPA has always provided more than the minimum legal requirement for maternity leave. As we do know that this time is important for women to recover, to adjust, to return to work as well, to prepare for that return to work. Women can also extend their leave by taking holiday balance or taking sabbatical. This is something that we have supported in the past, as well as reducing the activity rates when returning to work. These are all things that we do to support the transition back to work, to make it more smoother and also less stressful for women. As you may know, and Amal mentioned it at the beginning of the event, SICPA is a family-owned company, which means that we place a strong emphasis on supporting well-being for employees, but also their families. So family is very important for us, and this is reflected in our policies, in our processes, but also in the culture and in the way we handle family situations. I like to say that SICPA is a human-sized company, and we can allow to handle each situation on a case-by-case basis. Of course, we have those processes in place, but we also look at each case on a case-by-case approach. You talked before in the panels about pregnancy health, about maternal issues, menopause. At SICPA, there's a certain flexibility when it comes to medical appointments, when it comes to appointments for their own health, but also for childcare. I would like to talk a little bit about this because I'm recently concerned with this issue, and it's true that in the first years of life, children get sick very often. And when a kid is sick, usually parents are sick as well, or they are not feeling well. They are also stressed. They have to jump out of meetings, of professional commitments, take care of their children. And there are a lot of things that are covered by our policies, like days off to take care of the sick children. But there's also a lot of understanding from managers when that happens, and this you can feel it. One can feel it. Family is important, and managers usually show support when that is required. There are a lot of things that we do. We also partner with the Red Cross, who can provide emergency nanny services when a child gets sick. We can immediately call in and have someone at home taking care of the child, so we don't have to jump out of work to handle the situation. This is more on the child part. But we also have other things related to mental health, more related to well-being at work. We have partnered with CVCI, which is the local Chamber of Commerce in the canton of Vaud, on a program about conflict management. And the CVCI provides a neutral external mediation service to support employees, so both men and women. But we know that unfortunately, often it's more women who take advantage of these services. They handle sensitive issues related to psychological, sexual harassment, and we provide this external service which is neutral and for people to feel safe and that their issue is handled in a respectful way. In September, we have held a 2-day event called Health Day, SICPA Health Day. We had a range of activities like yoga, cardiac coherence workshops, personal development sessions focused on posture, well-being, smoothie tasting, healthy food. We are also planning another event of the kind in January to keep the momentum going and also encourage these activities throughout the year. It's a shame we couldn't hold the event on site on the Alumni Trust campus. You could have also see with your own eyes the kind of facilities that we provide here. On the campus, we provide a fitness room, we provide a breastfeeding room, a prayer space, a game or relaxation room, all this to promote a more balanced and also supporting environment for all employees. We also encourage physical health. We sponsor diverse sports competitions to give employees the chance to stay active, to build a team spirit, engaging in this kind of competitions together. We also provide an annual flu vaccination program. And recently, we have launched a Pink October campaign. As you can see, we all, from SICPA, we all have the background, and I will let Almudena talk a little bit more into details about this global campaign that we have conducted across the month of October. I would like to conclude by just by saying that we are doing a lot of things. I've seen today from the different discussions, different panels, that there are a lot of things that we could do even more. It was very interesting for me to discover all these tools, all these innovative companies that are working to promote women's health. And I think with the entire HR team at SICPA, we are happy to explore into more details how we can onboard or promote those tools. Almudena?
Well, thank you very much, Juliana, for this for the information. Yeah, well, actually, I'm the HR manager of SICPA Spain. I'm located in Madrid, so I can also give both the perspective on a global of the global team, but also on things that we are doing in Spain, where we are a small entity actually, so not as big as we are in Switzerland. But yeah, as Juliana mentioned, we have a global wellbeing program, which is called OASIS. I'm part of the Global Wellbeing Committee. And this program is aimed to provide the principles of well-being at SICPA on a global basis. And it is part of our human resources pillars. As I said, we have a global committee, which is composed by people in different areas, such as health and safety. We have also people from the corporate social responsibility team, and of course HR, and our goal as a committee is just to ensure that the principles are followed. And then in addition, we have a community composed by local representatives in many countries, I would say all the countries. Because one interesting thing about SICPA is what Juliana already mentioned. We are not just one single reality, let's say. So we have we have presence in over 25 countries, very different cultures, very different. We have people in many countries in Africa, just to take an example. So we cannot just consider one single framework for anything, but not for well-being and health neither. So every country developed their own country programs with different approaches according to their needs. This has been already discussed with you, but the access to health services is not the same in every country. There are many examples in different countries, and of course, as a company, we can provide support in many different ways, depending on the culture, on the country, etc. And then speaking about well-being, actually, apart from the country representatives, we also have in some countries the role of ambassadors, who are volunteers that actively participate in activities, collect feedback, proposing ideas. So you don't need to be a manager to become an ambassador. You can be an employee with just interested, and that's the beauty of the thing, that we want to involve everyone into the health and well-being of the countries. By organizing activities, by creating awareness, etc. And actually, well, in Spain, we have many examples. I don't want to stand that much, but it is what I'm based. One good example is that for the last 2 years, we have a partnership with an online platform providing well-being content. So there's live content, there are tips, there are in many aspects, and also we use it to really promote conversations around health. So we want to include health in our conversations and in our internal communication program. We oftenly create very simple games, very simple competitions on sports, on other things, so that people can talk about it. And that is because one of our main principles of our well-being program is awareness. And this is a word that you said quite a lot during this session today. We need to create first the awareness and a culture of prevention around health, and especially women's health. That is for sure. But also we have an holistic approach. So we want to embrace not only just physical or mental or just to do some activities, nice activities, cool activities, because sometimes I think that this is sometimes it's easy maybe just to organize an event and that's a nice activity, but that's all. Okay. Now we want to touch every single aspect of well-being, like physical, mental, social, speaking about financials, speaking about nutrition. And as Juliana said, I think that we have still a lot to do, a lot of room for improvement to incorporate as a company this women's perspective, women's health perspective, because there are so many changes in our lives, and from motherhood, of course, to menopause, to menstruation. You already talked about it, but it is true that we need to incorporate those conversations as well. Yeah, Juliana mentioned as well, we have this Pink October, which is the background we have now. Tomorrow we will move to November, so it will be November. So we are also encouraging men to grow a mustache during the month. And so we also want to speak about men's health, why not, as well. But during the Pink October, we had campaigns or an event in all the countries. On a global level, for example, we successfully launched an event with some experts on cancer prevention. So it was quite good. I mean, like more than 3,000 people joined at the same time in two different sessions in two languages, but it was quite successful. And I think these are the kind of things that really create awareness around health. And another powerful tool that we use, and I think that this is a bit touching the technology, because there were many conversations around technology, which I think is essential nowadays, is and I would like to talk briefly about is our employee voice. So we have an engagement survey, as many companies, I guess, but maybe the differential point is that we introduce the concept of well-being and health within our questions. So we have a set of questions, a quite long set, in-depth set of questions into well-being and health. This is run once a year. And of course, we can then analyze the results by country and get to know what is needed in one country or the other division, but also gender. And to get to know the major concerns when coming to women's health. This is essential, as you mentioned. And this is interesting, but and some of you already mentioned it, is the fact that we as a company don't receive many specific requests coming from women in comparison with men. So is this that we are not concerned, or is this that we are still struggling to open this conversation or to make a specific request related to our health or our circumstances? Someone mentioned before that 8 women out of 10 or something like that, it is not is not comfortable or doesn't really speak about her health, menstrual health, to other colleagues. So is this normal, or this is something? Of course, we will come there. We will need partnerships and with you guys that are working more on the prevention technology and to help the companies to really build up a strong portfolio and strong proposal on well-being. We are still a work in progress, but for sure, I think that we will get there. Thank you very much.
Thank you so much, Almudena, for your really good insights. Also, Juliana, thank you so much. My next question goes to you, Juliana. Do you witness a specific demand from women to benefit from supporting tools in a company before they apply or sign the contract, because you're a talent acquisition manager? So do you actually witness that women have a specific demand for women's health tools and services?
Thank you for the question, Lara. We notice there is an increasing demand for what companies provide as benefits when it comes to well-being, when it comes to flexibility in general. But I feel like women are still afraid to ask those questions, especially in the early stage of the recruitment process. Often they wait until the very last interview, or even when we make an offer, to approach those topics. It can sometimes be blocking, when we talk about flexibility, when we talk about activity rates, when we talk about different things. So yeah, it's a difficult question to answer. I think women are still, I think Almudena was mentioning before, that women don't ask. They are afraid, or they think they may be discriminated. They think they may be penalized if they ask the question about health, about maternity. The recruiter may think or may judge them based on those questions. And it's a shame, because as I said before, we go to the final stage of the process, and this is when those discussions are usually take place. And sometimes, well, it's a blocker on most of the time on the candidate side for different reasons. When I have a recent example for example, on an activity rate discussion where the candidate wanted to for their own well-being to have a decreased activity rate. We didn't discuss this from the beginning. It was quite a difference compared to what we wanted, so eventually didn't work. And if that question would have been discussed at the beginning, would have been better for both parties, I assume. This is just an example, but yeah, I still feel like those discussions are not are taboo. I think someone was saying at the beginning in one of the panels. Well, also health, family situations. There are also limitations to what can be discussed in an interview. So this is also something that it's quite sensitive.
Yeah, I understand. Thank you so much. I don't know, we might have another little bit of time to address the next questions, but I think they are important. The next one goes to Monica, because Tech for Eva is really about addressing women's health with technology, so FemTech. So we come to AI, for example, as AI is not the sole technology addressing women's health, but really, I mean, Monica, in your sense, how can AI contribute to well-being in the workspace? If you have some examples. Thank you.
You are muted, Monica.
Sorry. So thank you for the question. What I would like to address is recent research I came across that shows that a lot of AI solutions that are developed or implemented in companies fail. And there are multiple reasons for that. And one of the reasons is the lack of understanding of the problem the AI should solve. So we need to understand the problem that AI could be solution to. But to do that, how can we understand that problem? This is with empathy, utilizing empathy. And who is perceived to be skilled at empathy? It's women, right? So we need to make sure that we have enough women participating in identifying those problems that AI could solve, but also enough women to train those algorithms to ensure that they are inclusive for everybody, for men, for women, for any minorities.
So true. This is very, very insightful too. I don't know if you want to, if we have time for the last question, Lan or Amal, you can tell us.
Yeah, well, maybe I have a question. I take advantage that I'm talking to a lot of HR experts. You know, as I said, women's health at the workplace is one of the themes that we want to explore. But actually, we would also explore the opportunity to, especially for the B2C products, we go for B2B2C, which means that company be the player, a middleman, not the one. The B to help promote B2C product for women's health, which means that company dare to either promote the solution that might not be mature yet, but promote to their women employee to be the beta testers, or by the very first one to have to test, to show your willingness to help women employees, but also to help startups to develop further this type of product. So I would like to know your opinion about being the, how can I say, the first model company to offer company benefits by acquiring maybe or subsidize some of the FemTech products for your woman employees. So whether it's something doable, you can imagine. A tough question, I know.
Who would like to take the question?
Yeah, sorry, I think that the video is off, but I'm still here. So just to prove it, I will try to respond to this question. Well, it's a tough question, of course, because we cannot, we will need to, as I said, we are still, let's say, developing, is a work in progress related to well-being. But yeah, why not? I mean, the idea will be just to see what the technology can offer, to target really, to get to know exactly what is the purpose, what we want to achieve. So it's something that we will definitely not say no, but we will need just to really to get to know exactly the purpose and to make a comprehensive proposal and approach to this. Definitely what you talk about is, well, I am quite impressed because there are companies working in prevention, working in this women's health, working. So there is a lot of technology and an evolution is coming for sure. So SICPA will not be out of this evolution for sure. That is what I can say so far. Yeah.
Okay. Yeah. From our experience, when we talk to some HRs or people in the corporates, because they want final product, something really perfect. Maybe everybody, the press talk about it. Then you dare to present it into the company because But if for some less, how can I perfect or it's not the final version of the product, is still in a testing phase, people tend to be very cautious. You know, we cannot talk about that if you're not very sure your solution, etc. But I think by the end of the day, this where the startups need the most. They need people to trust them. Or if you talk about the AI, they need data. So you need someone to provide their personal data to increase data set and so to apply AI, etc. So I think it's almost, that's also one of the reasons we try to use SICPA as a beta tester for this type of concept. How we can have HR of the large corporate with us, taking the course of women's health to also as a social responsibility, and to not only taking care of the women's health in their companies, but also to bring this women's health products to help to bring them to the market. Yeah, that's one of the direction that we would like to go for.
I could also add, Lan, I think it's an interesting question. It would be interesting to explore which of those solutions would be best to propose to our female employees. It can be done through different ways. We at SICPA have an employee benefit platform that we propose to employees. It's a platform where employees can benefit from discounts to different, very diverse range of partnerships, from retail to health, beauty, FMCG, all kinds of partnerships we have through that platform. And we also use the platform to reward our employees to for example, when they have a child, when they get married, when they celebrate their seniority at SICPA, their birthday. And we could, for example, imagine including one of those or several of those offerings into a new category, health, women health, FemTech, and it would be then the employee's option to select one of those services.
Yeah, okay. Yeah, that's very, very nice to know. Yeah, we will definitely try to make a selection of these products if it's possible to go through you as a company benefit, have a discount or something. So also to help them to go to market and also to get access to their women employees. Excellent idea. We follow up with you. Thank you.
Such a very nice ending, almost ending of a panel. This is really a great and direct interaction and example of what can be done. I still don't know if we have time for a last question, but my last question was actually in which direction our company is going in terms of women's health. But I think that it's been addressed by the great speakers today. And I don't know if you, Juliana, Monica, and Buden, I would like to add anything on this, but this could close the panel today. Well, I think we
already covered this part.
Yeah, exactly.
Thank you very much.
Thank you so much. Closing this panel. If you have any questions, just please write it down or in the chat or raise your hand. But I thank all the panelists today and the opportunity for speaking about this really important subject. Thank you so much.
Thank you, Lara.
Thank you very much.
Thank you for this last panel.
Thank you.
After these events, we can be sure that innovation and discussion are going on the right way for helping women. We've shared with you one of EPFL program Tech for EVA that SICPA is engaged by, and the Unlimited Trust Campus by SICPA is also engaged with other EPFL program around trust. Today, trust is a must with all the AI changes coming. We will have to create this layer of trust today on these new technologies. Thanks to Tech for EVA first for this roadshow organization and all speakers for sharing with us today innovation, experience, and insights. And also thank you to all our worldwide participants. After this roadshow, we can be sure that you can make an impact and make move on this discussion and innovation go on by sharing around you on your social account and Tech for Eva account. I will leave you their link on comments. Lan, I'll leave you the hand for the next Tech for Eva events.
Okay, great. Thank you all again from our part. Thank all the speakers. Thank for SICPA colleagues coming here to talk about their practice within the company, and thanks all our startups today for their generosity of sharing your insight in different areas. Though this is, as I said, this is our pilot project to do the roadshow with one company. So the aim is to not only sensitize the importance of women's health at the workplace, but also, as I said, to encourage company to consider to offer company benefits as a company benefits to promote our Tech for Eva and FemTech product to their women employees. So it's only the beginning. We hope more company can join this initiative, and we are very open to organize other events with all the other companies. Now, Tech for Eva has a yearly closing conference. And this time it will take place at Truth, the major university hospital of Lausanne, and on the theme of maternity and all the challenges and technology to secure a healthy and seamless maternity for all the women. So please, you can scan the QR code and book the date. We promise you a lot of insights, and also you can know better how Tech for Eva startup made the progress during the last few months. Okay, thank you everybody for your attendance and your participations. And we have also, the last slide is about the call for application for next year. The call will be open in December, and the new projects, if you are, you know somebody who is working on other FemTech technologies, encourage them to stay with us and take care of our call for application for 2025. And you can, the call is open already. So you can scan the QR code then and to apply for the next cohort. Thank you for your interest. And as it says, it is a course, and we would like everyone here to join us. And not only here, but maybe your friends and your friends of friends. Thank you very much. See you very soon.
Thank you very much.
Thank you.
Thank you.